About 1 million people aged 20 or older will be diagnosed with diabetes this year. And understanding diabetes is the first step in managing it. Dr. Kris-Iyer of Hoag Memorial Hospital Presbyterian in Newport Beach explains the warning signs and control management tips.
Diabetes, in simple terms, is when the body is not able to handle the sugar it has in its blood. Type 2 diabetes is the more common diabetes. It's usually due to the body not being able to produce enough insulin, and the insulin it produces has a lot of resistance. It is seen usually in older people, usually related to overweight, and there is a genetic component to it. Type 1 diabetes, on the other hand, is usually seen in young children when their body is not able to produce insulin because the pancreas, which produces the insulin, gets damaged by autoimmune process.
We asked Dr. Iyer how he diagnoses and treats diabetes.
If you have symptoms like excessive thirst, going to the bathroom to pass urine frequently, loss of weight, fatigue, sometimes infections, maybe the presenting symptoms when the diabetes has manifested itself severely. In a non-diabetic patient, you diagnose it by doing blood test. In a person who has symptoms, you diagnose it with the blood glucose in excess of 200. In those patients who have type 2 diabetes, lifestyle changes, very important. Diet, exercise, adherence to proper regimen to reduce weight are the key. Then there are medications that are available which can augment the lifestyle changes, and there are many medications available now. And later on in type 2 diabetes, when all these efforts do not succeed, we may have to add insulin. You have a genetic makeup, so that unfortunately is preordained, but the manifestation of diabetes is when you increase your weight, when you don't eat properly, when you lead a very sedentary lifestyle, you will get type 2 diabetes.
We asked Dr. Iyer what a diabetic should or should not eat.
A bad meal for a diabetic is something which is highly rich in high energy foods like rice, sugar, wheat, pasta, which have very high glycemic index. For a diabetic, excessive fat content of the meal is also bad. So if a diabetic patient were to come, he would be well advised to take complex carbohydrate diet, less of fat and more of protein. A good meal for anybody, and especially for a diabetic, is if you have to eat carbohydrate, because it does make you feel good when you eat carbohydrate, eat complex carbohydrates, more vegetables, more leafy green vegetables. Avoid those vegetables like potatoes, which will increase your blood sugar. And more smaller portions along with protein will be the best meal for a diabetic. There are vegetable proteins and there are animal proteins, and in moderate amount they will be really beneficial. They do not increase the blood sugar as much as simple sugars increase your blood sugar. Rice, wheat, pasta.